All right, so welcome back. And we are here in our middle of our seminar series on wildland fires. And we are, as you can see, still on Zoom. I've really appreciated the audience and the great questions we've been having over the last several weeks. I hope that will continue today. Again, I will acknowledge the Bill Lane Center, Woods Institute, Precourt, as well as Data Science for supporting this series. And just a heads up, I also want to just promote our Big Earth Hackathon, which is coming up spring quarter. So for the students out there, sign up and get involved, potentially take the class. For the faculty and staff out there, I hope you'll be able to promote this event and class to your students. And let me know if you have any questions, but a lot of the information can be found on bigearthhacks.stanford.edu. But without further ado, I am just so pleased to have Luke Beckman here today from the Red Cross to talk to us about his and the American Red Cross's perspective on wildfires. Luke is a Stanford Cardinal. He's an alum. He graduated in human biology, writing an honors thesis in crisis coordination through the Center of International Security and Cooperation. And he has spent the last 15 years leading public health and disaster response operations. He has led crisis operations at the local, state, and national, and even international levels. He has responded to everything from hurricanes and typhoons to floods, tornadoes, shootings, and earthquakes. He has also led mass cure operations for every major wildfire in California since the Thomas Fire in 2017. Luke is most passionate about readiness and empowering people to be resilient in the face of crisis. And he loves to build, teach, and learn. And actually, I've learned quite a bit from him over the last year or two since I've met him. He currently serves as the American Red Cross Disaster Director for California, focusing on state relations. And so we're pleased to have Luke here, and I'll turn it over to him. And I encourage you to listen and ask questions along the way. And he's promised to have left a significant time so we can have a nice dialogue and Q&A session after his talk. Thanks for being here, Luke, and I'll let you share your screen.
Thanks, Derek. Good to be with you all today. I love this series. I love what Derek and the whole team at Stanford is trying to accomplish here. And I think you all are exceeding your own expectations. And I love learning on these talks. And so I'm thrilled to share some information with each of you today. Derek, just a quick check. You can see my screen title slide, responding to wildfires. Perfect. Thank you for the thumbs up. So again, I'm a Stanford guy. Glad to be with you all today. We're going to talk about responding to wildfires. And Derek had asked me for, going back to the academic world, an abstract. I was like, what's an abstract? I had to remind myself, talk to my wife, who's a physician, and be like, you write papers. So we're not going to do a paper. I've got about 20 slides. So call it 2 minutes a slide or faster, and we'll do a lot of Q&A. I want this to be conversive, and afterwards, you've got my email and you've got my phone number. Let's figure out how we can collaborate together. And I live right around the corner from Stanford, so it makes it easy if you're on campus. So we're going to talk about what happens to someone when a wildfire burns through town. I want to focus on the resident, the individual level. We're going to explore the human response from all the way from fire notification to rebuilding. And we're going to focus on what happens to those who are most vulnerable. Because I think really at the end of the day, most people are going to get out just fine. The home won't burn. But what we're seeing is more and more people fall into that vulnerable category. So I wanted to find that for all of us and look at some of those life stories because they can be really heart-wrenching, and more that number in that population is growing. So very quickly, the simplest way I can describe wildfire fighting, I'm not a firefighter myself. I do teach and instruct CAL FIRE, their advanced all hazard incident management course. So I spend a lot of time with fire guys. I'm a medic, so I get to do the first response thing, but on the Red Cross side, we're kind of the second responders. But you'll see as fires grow larger and as they move faster, we're shifting into that first response space as we catch people. So fire fights the fire. That's their job. The bigger the fire is, the faster it moves. You're going to see fire bleed into this world, which is law evacuates. But if the fire is going really fast, fire is also evacuating. And that's important to note, because if fire is evacuating, they're not fighting. And there's a big challenge there as resources get more and more overwhelmed. So you see here, medical patients, people in wheelchairs getting loaded into sheriff cruisers, sheriff deputy cars. So we're seeing this a lot now. Most people don't go in a first response vehicle. This is kind of an extreme, but we're seeing more of this. And then the Red Cross and social services, county social services predominantly, do the mass care, shelter, food, and comfort. You see here a big Red Cross shelter. So the flow of a wildfire from the human side is there's preparedness and readiness. That's what we're doing today, every day. Preparedness, I like to think about, there's a whole official, if you study emergency management, prepare, respond, recover, and then they throw in mitigate. The way I like to think about it is preparedness is what you do as an individual or as your family. The readiness, that's kind of the societal readiness. What are we doing as a society to get ready? But we first are looking at weather conditions, and where you see the stars, I'll have a slide that focuses on each of these things. So for a fire to burn, there really has to be good fire conditions, which means bad weather as far as a human is concerned. Then there's ignition, the fire starts. Then we have detection, we have notification, we have evacuation, and then as the fire gets under control, re-entry and recovery. And all the way from ignition all the way up to re-entry, fire is fighting that fire. But I won't cover that today. I'll share this slide deck with Derek so you can all have it. The link I put here, this PDF, which is short enough, I guess you could type in, talks about some very specific fire terminology from CAL FIRE. Preparedness and readiness today. You'll see readyforwildfire.org is a great resource where they talk about the Ready, Set, Go program. Those are resources that are available to you as an individual or a family or a community. Then there's also wildfirerisk.org, which is a really important, helpful site that helps you understand at a community level what your wildfire risk might be and what you can do about that. Then there's a lot of focus on evacuating quickly and safely. I put a hyperlink in here. We at the Red Cross are trying to come up with new, I'll call it more innovative, but I think in some ways we need to catch up, new and innovative ways to help people think about evacuation and doing it safely, and really simplifying all of the stuff out here that exists in preparedness to make it very actionable and practical for a family. We talk a lot about defensible space, that is actually hardening the structure, your home, and creating a physical boundary so that approaching fire doesn't burn your home. And I talk here and say focus on embers. I think in some of the talks you've heard about this increasing reality and awareness that most homes, most structures are not actually burning from the fire front, meaning the big wall of flame. They're burning because embers are shooting way in front of the fire, and those embers land on some leaves in your gutter. The gutter burns, and then that burns your home, for example. And so two of the very interesting, there's some very preliminary data starting to come out from some recent fires, but two areas that we're trying to think about and focus on in the Red Cross is this 5-foot no burn zone. And as we support fire departments and agencies around the state, around the West, and around the country, how we can help educate people on this 5-foot no burn zone. And then also things like combustible fences, meaning the fire catches on something that burns very easily, and then that burns all the way up to and against the home. Now you have a fire burning next to the home, that burns up, that burns the gutter, that gets in through the eaves and the roof, burns the home down. So we're seeing more of that, and looking at what are if you think about the 80-20 rule, what are the smallest, easiest interventions we can take that have the biggest impact. We'll talk about that in a little bit. And then focusing on the home assessment. We've got to assume that fires are going to happen. People choose to live and continue to rebuild in fire-prone areas. Fire is a natural part of the landscape. And so how do we help harden homes so that, knowing that fires are going to happen, that we don't see the loss, the repetitive loss that we're seeing over and over again? Because at the end of the day, on the Red Cross side, we're dealing with the people, we're catching them. So we talk about fire weather conditions. You basically have a fire weather watch, and you have red flag warnings. And so those are things that people more and more are looking out for and listening to. And you'll hear a lot of talk of, oh, there's red flag warnings up in the Sierras. Basically, that means that conditions are going to be really bad for humans, really good for a fire starting in the next 24 hours if you hear red flag. And that basically means the temperatures are going to be high, the relative humidity is going to be low, very dry air, and there are going to be high winds. So that if a fire starts, that fire will burn very, very quickly. And if you're thinking about, getting out of town, those are some of the trigger words that we need more and more people thinking about. When we look at notification, they're more and more just about every county in the country in a fire area, and even outside of a fire area, has some kind of emergency alert system. Sometimes you might have a county and a city emergency alert. You might also be able to sign up for a law enforcement or a fire emergency alert system. And you can usually get this over text message, email, or phone call. And then there's the traditional radio and television. I'm listening on the radio, oh, a fire is burning up in the hills, or you hear that, this neighborhood needs to evacuate. So you can hear about it in the, I'll call it the traditional media sense. A lot of people, and I should have put in here social media. Twitter is probably the best real-time, no, it is. Twitter is the best real-time source of fire conditions, just based on how people use it. There's fire departments post usually, and law enforcement will post on Twitter and Facebook, more and more on, and TikTok, maybe Instagram, but reliably Twitter just kind of becomes this feed and almost a historical record of the fire and what happened and what progresses. And then you get a lot of, I'll call them fire junkies, amateur radio people who actually are watching and listening, who are providing a very critical public service in alerting in real time what's happening. And then there's also kind of we're innovating back, meaning this traditional emergency siren. So back in the Cold War, World War II, in the 40s, 50s, 60s, 70s, 80s, there were a lot of cities that had emergency sirens. And you're seeing this now as more and more text messages or the phone call doesn't go through because the fire moves so quickly. What does work is hardwired infrastructure that tells people exactly what's happening. And so you're seeing some counties, Sonoma, Lake, Colusa, I think, we're doing some pilots around what they call high-low sirens. So if you search Wildfire high-low siren on YouTube, you'll see a dozen examples of sheriff cruisers, police cruisers that kind of go beep, boop, beep, boop, very, very loud. And then there's also long-range acoustic devices. These are used in the military, in emergency management, but this idea of giant speakers on a telephone pole that you can hear for a mile, where people are saying, fire's coming, you need to evacuate. So going old school. When it comes to evacuation, people check multiple sources. And so knowing that you might tell someone something once, they may ask their neighbor, call their family. They're going to vet that themselves. We see that happen over and over again. Oftentimes, I think some of the data suggests that on average, people will check 3 sources before they evacuate. I found from the state of Idaho and the Idaho Firewise community, a lot of people don't put these numbers up, but they did, and I was grateful for it, that about 60% of wildfire fatalities come from when people are waiting and seeing. And that's a really important thing, because people evacuating it's hard. And so people really want to try and figure out, hey, do I really need to go? And we talk about the crying wolf of, oh, well, you told me to evacuate last time. It's probably not going to be bad, so I won't go this time. Evacuation warnings and orders in California, you'll hear about warnings and orders. In a state like Oregon, they'll talk about level 1, 2, and 3 evacuations. So there's not a national standard on evacuation terminology. 1, 2, and 3 means level 1 is ready, level 2 is set, level 3 is go. That would be the mandatory evacuation. And then more and more, you're seeing communities organized by zone. And there's a disconnect at times between the first response community and citizens, where first responders will talk about, zone 22 whiskey. To an average citizen, what does that mean? I just really want to know, where my home is, do I evacuate or do I not? How do I make that as simple as possible? And more, if you go on any kind of mapping platform, I'll just take Google Maps as an example, more and more you'll actually see fire perimeters when a fire is burning. But we're not yet at the level where all evacuation information has been aggregated. But I know that you all are going to solve that in the hackathon that's coming up. So we're pretty excited to get that one out. So that's a little bit about evacuation. But let's talk about the situations that people are evacuating in or from or through. So imagine, just kind of picture, these are different kinds of people living their lives in very different ways, but all of them are going to be impacted by fire somehow. And you may fall into one or multiple of these categories. You may know people who have had to do this, and you may have done this multiple times. I know on a lot of these calls, this brings up a lot of, for folks who've been through wildfire who live in the West, it can bring up some pretty jarring memories. So think of a couple with young children or a pregnant mother. I've got to evacuate. What am I going to do? You have a rancher who has livestock, someone who lives in a nursing home, or someone who's a care provider in a nursing home, people who are in hospitals, either workers or as patients. You might have a non-English speaking migrant family. So you could be, working on a vineyard and a fire comes. What do you do? People who are new homeowners. So you're new to the area. You don't know much about anything. You just know that you want to live in the mountains and Lake Tahoe is beautiful. Go. People who are experiencing homelessness. Some may live in an area for 10 or 20 years. Some may move as the weather changes. So again, you could have somebody who really knows and is well established and is experiencing homeless, and you may have somebody who's relatively new to an area. Then there are people who rely exclusively on public transportation to get around. They take the bus to get around town. They don't have a car, but they're independent. Then you have people who we talk about precariously housed. As I put, living rent-free with Uncle Bill. I'm trying to find a job. It's not too stable. I don't have a lot of cash on hand, so I'm living with family or friends. But if Uncle Bill loses his house, I'm out on my own. I'm not technically renting, and I'm not an owner, so I don't have the insurance. What do I do? Where do I go? Then there are people who are post-operative. So they're recovering from a surgery. So they're less mobile. Somebody in a wheelchair, somebody with a cast. You get a lot of those folks. Then there are people who are homebound with complex medical conditions. So I'm able to live independently in home because I have this device, I have this handrail, I've got this lift that I can pull myself up on. But if I have to leave my home, I don't have any of those things. So what's going to happen to me and how can I function in that post-evacuation or in that evacuation environment? And then tourists, depending on where the fire happens, you might have a very high tourist area. And so as we think about this, I want you to be thinking about where are these people going to go? And then how are they going to recover if they lose their home? And if they go somewhere, how long are they going to be there? So that's really what we're dealing with on the mass care side in the Red Cross. So let's talk some numbers. Mass care planning is actually very straightforward. And if anybody wants to help me be a mass care planner, let me know after this. I will train you up and we'll put you to work this fire season. But we basically plan against a peak shelter population. So as a fire burns, fires are tricky. When a hurricane comes, we know when it's going to make landfall, and then it weakens and it goes away. A tornado touches down. Think about Kentucky recently. We've had a lot of team members deployed there, and it rips a terrible swath through the land, but then it's gone. A fire is kind of a wildfire and a hurricane together that never leaves or dissipates. So imagine a whole bunch of tornadoes that could start up all at once. That's wildfire ignition in red flag conditions. So think about the lightning complex that happened 2 summers ago where boom, fires all over the place. So I've got a whole bunch of tornadoes and we don't really know where they're going to go. We have an idea. That's what fire weather forecasts are for. And we're fighting them. We're trying to contain them or guide them really. And they could burn for a month or 3 months. You never really know. Or they could be out in 2 days. So that's why the complexity of fire is very different. The response model is different. So we're trying to figure out a peak shelter population. 10% of people who evacuate for a hurricane, we assume that 10% will seek mass care, even if it's just for a night, right? I go to the evacuation center. Then the hurricane leaves, I can go home, or I hope I can. In wildfire, we realized 10% was a high number. Historically, it's about 3%. In California, could hit 5, could hit 8, but an average planning number is about 3% of people who evacuate will end up in a Red Cross shelter at some point. The rest are going to family or friends' homes, hotels, parking lots. They may go 10 miles outside of town. They might fly across the country. And then we also assume that of that 3%, 10% of those people will end up staying in the shelter and require some kind of medical cot. So we talk about cots and blankets in a shelter. It's a specific kind of cot, which also helps me understand it's a specific kind of care that person might need. So how does mass care work? Quite simply, it's shelter, food, and comfort. Those are the 3 things. We'll dive into each of those on the next 3 slides. But 95% of shelters that you see end up being Red Cross managed and will have Red Cross workers in them. 95% of the people working of Red Crossers are volunteers. 5%, like me, are paid staff, but everybody you've ever seen who's a Red Crosser is volunteering their time. They might be local, or they may have come from across the country. They may have never set foot in Colusa County or in Yuba or Sutter or Butte or Napa or Lake, but they're trained in how to do mass care. And we have people who are trained to work and learn the local politics and learn the local culture very quickly. And you'll see people come in from the outside on those larger operations. That's how we scale. But think of a mass care operation kind of like a county fair or Byron Bailey's traveling circus or a business startup. You basically go from 2 people responding and opening a shelter to potentially several thousand responders. And that may go for 2 weeks, that may go for 3 or 4 months. So you basically build up a business organization and then we shut it down. And then we hand it back over to the local region, hopefully not having broken relationships. So it's all about supporting and scaling, flexing within the overall structure of something called the incident command system. The Red Cross works hand in hand with government. We could, but we generally try not to go set up a shelter all by ourselves. We're basically saying from government, hey, where do we want to have shelters? Where does it make sense? But we are very important. We emphasize the fact that everyone is welcome in a Red Cross shelter. It does not matter your documentation, your citizenship status, or anything like that. You are welcome to stay in a Red Cross shelter. These are the rules, follow the rules. And it takes a village. So you see here, voluntary or community agencies active in disaster, or voluntary community organizations active in disaster. VOAD, COAD, voluntary organizations active in disaster. There are many different nonprofits that take part in the mass care world, from preparedness to response to recovery. Let's look at shelter real quick. Examples of shelters would be schools, gyms, churches, fairgrounds. There might be outside populations, so people stay in the parking lot at the fairground and they want to put up their tent, their RV, or their trailer. Or the big inside, like you saw in that picture, sort of a big open space, cots are spread out, and pick a cot, get your blankets. So cots, blankets, and comfort kits, normal hygiene items, toothbrush, toothpaste, dental floss, tissues, things like that. And then many counties will generally have only 1 or 2 mass care employees, people who work generally within the Department of Social or Human Services, which we call ESF 6, the Emergency Support Function 6, within the Incident Command System framework. Then you can have a county like San Diego or Los Angeles that has a whole mass care section. They've got the resources for it. But you have a mix in mass care and sheltering of experienced staff, people who've been doing this for 30 or 40 years, and then brand new, newly trained, or what we call event-based volunteers. Some people call them spontaneous volunteers. And so the idea here is, we know we need to scale. We know that local residents who can help are the best people. They know the community, they know their neighbors. And so we're constantly working to, when a disaster happens, we sort of open up recruitment for local team members. We train you up, and in the span of a day, you could be, hey, I want to help, to, hey, I'm trained, to, hey, I'm working in a shelter. Shelters can last from days to months. As I said, everyone is welcome. We're also focusing on pet support. That's a really big one, because nobody wants to leave home or stay somewhere without their dog or their cat. We're focusing on infection control, which became hugely important during COVID. We even pivoted to what we call non-congregate shelter, where we put people into hotels and motels rather than the traditional big open air shelter. But there's also things like you could have tuberculosis or influenza or colds moving around, but most common would be something like norovirus, which moves around very quickly in a shelter. So you want to make sure you've got good relationships with public health. And then we count everybody at midnight. We count the number of heads on beds. We call it heads on beds. So if there's 150 people sleeping at midnight, or 11 p.m. or so, it's 150. I report that up, and that's how you get a shelter count, and that's where those numbers go. So there's one shelter count for an entire fire. And that gets shared with the media, that gets shared with responders, and we use that to track, as I said, that peak shelter population, and then how are we moving, how are we getting people out of shelter to that next journey in their recovery. On the food side, the Red Cross doesn't own or have kitchens or chefs. There are lots of restaurants that do that. There are lots of nonprofits that do that, many caterers, and then also large contract companies. A great examples in California of sort of the top nonprofits who are working with us on this as our closest partners. World Central Kitchen is growing out of with headquarters in DC, the Salvation Army, Southern Baptist, Suu Kyi, let's see, a lot of Sikh groups. So you can get religious organizations that are helping with this. Our partners cook the meals. The Red Cross in the shelter will often serve the meal, but we may partner up with the Seventh-day Adventists, or we may partner with Catholic Charities and they serve the meals, but meals get served in the shelters. And then we also have mobile delivery vehicles like a food truck that go around a community and can serve meals. Other organizations do that as well. And we count the meals every day. So we count everything. We're paying attention to dietary restrictions, whether that's medical, cultural, or religious. And then we're also focusing on food safety. The comfort piece, I switch headphones here. Okay, still there? Perfect. So on the comfort piece, this is pretty all-encompassing, but health is a big one. We practice a community nursing model. So if you're an EMT, emergency medical technician basic, a paramedic, a nurse, or a physician, or anything else, you're basically going to operate like a nurse, a registered nurse would. We focus on eyeglasses, prescription replacement, dentures, durable medical equipment, replacing those, repairing those, helping people, get back on their feet with those items, whether that's money to buy replacements or whether that's helping call the pharmacy because you've got to move your prescription to a new pharmacy because you've evacuated. And then respiratory support. That's a big one as well. A lot of people come with oxygen tanks. With fires and the clients, we call them clients, people who stay in shelters, the air is not good with wildfires. So a hurricane or tornado goes, air is fine. With wildfire, that's a huge issue, and one I'll talk about in a little bit more detail. We also focus on mental health. So we have certified mental health professionals, and all of these folks we're working with county, could be state agencies for health and mental health. On the spiritual care side, Red Cross is a non-denominational organization. We don't care if you care about religion, if you practice a religion, but if you do, we know that's really critical to supporting one's recovery, right? Just with PTSD, with just repetitive trauma and loss. We want to create a safe space and an open space where you can voice what's going on or you can practice your religion. So we have spiritual care team members as well. And then there's what we call disability integration. This touches all aspects of mass care. And we call it reasonable accommodations. But we basically say, hey, if you want to stay in a shelter, we're going to do everything we can to support that. If you need to get to a nursing home or a skilled nursing facility, we'll work to support you in that transition. But as I said, a lot of people, more and more, as the population ages, as we see more instability and more chronic health conditions, a lot of people have a good routine at home. When the fire happens, any disaster, that routine is broken. And so there's a lot more complex challenges where a single person might require a healthcare team of 4 or 5 people in a shelter, whereas at home, you needed one person to come by every Monday, and that was it. So scaling to a large operation, that would be an example of people from one county evacuating to multiple counties, or from Californians going into Nevada, or Oregonians coming down to California. We saw that this summer with the Caldor and the Dixie fires, people from Lake Tahoe in California evacuating into Nevada. There can be many different shelter types, small shelters, large shelters. And then you also see the initiation and creation of the Mass Care and Shelter Task Force in the state of California. Other states are working to build a mass care model. The Red Cross co-leads this with the Department of Social Services. I usually serve as the Red Cross lead on the Mass Care Task Force. And our focus is on resource adjudication. And so really when something is a disaster, those local resources are overwhelmed and you need support in whatever area is required. And so we have a mission tasking process where very commonly a mission, right, is I am in a county and I require shower trailers because the shelter we picked doesn't have showers, or we need toilets or hand washing stations, or I need 5 public health nurses. So somebody raises their hand and says, I need help. That becomes a mission. It gets tasked to a state agency and up to the mass care task force. And then we adjudicate that. We basically fill those and meet those needs. So considerations when getting back on your feet. People are thinking about, do I still have my job? Can I get to my job? Do I have transportation? What about school for my kids? Am I in a place where my doctor is still in town? Can I get to appointments where they canceled? Does the new area have the specialty that I need? Are the utilities turned back on? Is my social network still in place, or are all my friends and family gone? A lot of people will say it doesn't look the same, right? Because all the trees are burned and they get cut down. So what I knew no longer exists. Insurance, did I have it? Did I have enough? How long is the claim taking? Then there's the whole rebuilding process. What's that cost to rebuild? Can I afford it? Are there any contractors in town? So the recovery process is very, very complex, especially when more and more homes are destroyed. Top 6 vulnerability factors for wildfires in the US. These are families who live in poverty, people with disabilities, people over the age of 65, people who have difficulty with English as their primary language. It's not just Spanish, there are lots of other languages spoken in community pockets. So we've got to be thinking about multilingual interpreters and translators. Households without cars, right? I talked about the person who relies on that public transit or their family member to drive them around. And people who live in mobile homes, that's the last one, simply because mobile homes are more prone to burning. They are less hardened, easier for them to burn from embers and fires. So let's think about for a second the some of these things of people who have the means, people who are more resilient. Some people might say the haves and the have-nots. Someone might fit 3 of these bullet points, or they might fit all of them. These are people who can rebuild. Insurance covers their costs. They have savings, right? They're financially stable. They have a strong network. They didn't lose their job, or maybe their hours were only reduced by a little bit, or they had a flexible work from home job, so they could be anywhere. They can navigate the complexity and the frustrations of their recovery process. They can maintain positive, or they can maintain a healthy lifestyle, right? They don't decompensate as a result of that wildfire experience, and they can get back home to their neighborhood. Let's look at the flip side. People who are priced out of rebuilding, they can't afford those contractor costs, or somebody's trying to buy them out. They don't have the insurance, no savings, a weak social support network. They might be unemployed or underemployed. They're not able to negotiate and navigate those complexity and just the recovery process. Their underlying health conditions worsen, or they can't find adequate housing. So somebody may only need one of those bullet points to fall down on their feet. And more you might see somebody who checks all of those boxes. These are the folks who end up in Red Cross shelters. These are the folks who take the most work to try and help them through a long and ultimately arduous recovery process. When we look at rebuilding and the recovery process and debris removal, this is a big one. The state, if there are roughly 500 homes or so that are destroyed, the state will set up a debris task force. If they're less than that, they'll just bring in some specialists. This could be 15 different agencies on this task force, but they're going to assess the property damage, first starting with household hazardous waste. So you're clearing, and this is, you don't get to sign off on this. The state comes through and says, we're going to grab all these different things. You just think about everything that exists in a home. If that burns, chemicals, liquids, metals, whatever. Then there's debris removal. So people will drive by your property and they'll assess it. This is where you actually have to sign off and say, I want to go through this process, state of California, for example. And this process is the state of California process, but it's been honed over and over again over the last 5 years, and longer, but especially in the last 5 years. So property gets assessed, asbestos is removed from the property, cars are removed from the property, the soil is sampled and then literally scraped with bulldozers, right, to get those chemicals out. And then that soil is taken to a hazardous waste dump. Ideally in the county where the fire happened, but sometimes out of the county if there's no space in the landfills. Then erosion control takes place, right? You don't want the whole landslide, the whole mountain coming down. Then there's tree removal. And so the state will actually remove trees. If the tree is anywhere near a public road, a public access point, if the tree's on the back of your property and it's not going to fall on a road, but we know it's going to fall, state's not going to touch it unless it would potentially injure one of the workers on the property. So that's an important thing. Then the state will sign off and then hand it back to the county. At that point, you as the homeowner can begin your rebuilding process. Safe to say it might happen in 2 months, but overall, safe to assume that about 3 months from the fire is contained in your area. So the fire may have burned through, it could still be burning over here, but we can begin the debris removal and the recovery process here. So about 3 months. It could be a month and a half, it could be 2, but 3 months on average. So what are some of these indicators of social impact? And I stole some of this from Dr. Michael Wara, who gave a talk not too long ago, but I think it was brilliant the way he stated some of these things. We talk about number of acres burned in a fire, or number of structures lost or number of fatalities, but does that really tell us? Certainly on the Red Cross side, that doesn't really tell us what the human impact is. So if we could start getting this kind of a catalog of fire history, I think it'll help us adapt on the human side much more quickly. So how many people are evacuated, homes threatened or destroyed? How many homes were saved because of defensible space? The news talks about the bad things. We don't talk about the good things. And a lot of times it's because reporters aren't educated about what a good thing is and what that means, because it can still be a really powerful story. It doesn't just have to be looking at ash. So how many homes are saved or communities that are saved due to defensible space? How many uninsured people lost their homes? What number of people were displaced from their community after the fire who never came back? What's the number of hospitalizations or deaths from smoke inhalation? And actually, out of some of the studies starting to come out of Stanford are actually paving the way and really trying to put numbers on this and showing just how many people are impacted by wildfire smoke. What are the number of pregnancies that are impacted? We're already seeing some really concerning and shocking data on that. Some of the questions that the Red Cross is trying to answer look at sort of the preparedness and the readiness piece and just new kinds of strategies. But what are some actions that could give us our highest return on investment, rather than saying you have to do all these things on your property, it's going to cost you $60,000. What if you did 2 things that cost you $400? What are those 2 things? We don't know right now. I talked about that 5-foot no burn zone and the combustible fences attached to the house. Maybe you could detach that or put in something that's not going to burn. Those could have huge returns on investment, but we just don't have great data on that yet. How can we catch the most vulnerable people so they don't fall through the cracks? What are the best strategies for temporary emergency housing? There's a lot of really cool companies doing 3D printing, and we'll LiDAR laser survey your land and we'll build the house over, the prefab house over in Minnesota. A truck will come in and in 72 hours, I haven't seen it done post wildfire. I'm sure maybe it has. If you know, let me know. I'd love to see it happen soon. But this idea of they're in, they're out within 72 hours. So you don't necessarily have a contractor taking up a very valuable hotel room in a community that a resident needs. You're in, you're out, you're on your land, rebuilding pretty quickly, costs are lower. Who knows? And then what interventions can we take around wildfire smoke? That's a big one. Right now it feels kind of helpless, other than, hey, wear an N95 mask, or you should have this kind of air purifier. A lot of people can't do that. People have to work outside, people with those chronic health conditions, respiratory conditions. Where can we start trying to change the game a little bit more? Some other research questions that we might want to be asking. What are the societal costs of wildfire? How do those interventions map to the impacts that we care about? What are the impacts of fuel treatments on risk? Impact of home hardening on risk? The impact of grid hardening on risk? And then how cost effective are wildfire investments? I think I stole it right from Michael's slides, but again, it's brilliant, and we need to be just pounding the pavement, asking these questions and trying to find research teams that want to look at this stuff. And that's all I have for you today. So let me know how we can collaborate, but I want to save some time for some questions and answers and just have a discussion. Derek, back to you.
Luke, I think I speak for everyone here. That was really comprehensive. and gives me even a greater appreciation for what the American Red Cross does. So just before I forget, a thank you to you and the many, many people who work at the American Red Cross for your service to our people. With that being said, please feel free to raise your hand and unmute yourself. I do have a couple questions in the chat that I think were partially answered, but I'm going to let Kari and Bill in that order speak up themselves to maybe dive a little deeper. So Kari, do you want to ask more about air quality?
Sure. Well, first of all, thank you so much. That was excellent and really a good overview of all the wonderful work the American Red Cross does. And thank you so much for all of your service, like Derek said. We really appreciate it. And I hope that with the hackathon, we can address some of the unmet needs. And I talked about clean rooms, but I was wondering, as we look at global climate change and as we look at the increase in wildfires to come in the West, what are some of those key unmet needs that are facing the American Red Cross right now? And where do you see some of these challenges needing to be met by academics? What research would you think would be very helpful to get the support and resources needed for the American Red Cross? Because at some point, you're seeing the increases in climate change and wildfires to be so much that we hope that we don't outpace the Red Cross, but we know that that might be coming. So what does your future look like, and how can we help you address those challenges?
Thanks for the question, Kari. Some of the bullet points I think that I put into the slides, and again, I'll make sure you all have access to the slides, and I just put in my email and my phone number, so we can, anybody who wants, we can talk after this at whatever length you'd like to really dig into the details. But I think on the preparedness side, and we're already talking to some folks at Stanford, looking at what are humans doing? What's that behavior piece? What, like, is our preparedness messaging even getting to the people who need it, or is it going to the people who already have access? Right? Are we actually solving a problem? We don't have great data on that. We just know that we deliver this preparedness message and 100 people watch this video. What does that mean? In terms of the human side, we're thinking in three H's, I'll call it: housing, hunger, and healthcare. And so when we think about, at the end of the day, if a fire burns through an area and no homes are destroyed and people evacuate, in a perfect world, and I like to sort of paint the picture of the perfect world. In a perfect world, people aren't suffering from smoke inhalation. Their insurance, if they have it, is covering wherever they need to stay. There's enough hotel rooms for them to stay. No homes burn. The fire is fought. It's contained within a week or two, and everybody goes back home. That's a perfect world. So any deviation from that is less than perfect. And I think on the housing side, just housing stock across California and the West and the country is pretty abysmal. And so the fact that reconstruction costs are so high, anything we can do to get people in a home in their community of choice, I'll put the humanitarian hat on, keep it on, in their community of choice, the faster we can do that at better cost, the better. That's a huge research area right there. There are lots of political conversations to be had around, do we want people to come back to the community that had the wildfire? But I will take the side of reality, which is history is a good guide, and it shows us that people are coming back, whether government wanted them to or not. They're going back to where they were, and they're trying to rebuild where they used to live if they can, and if they mentally and emotionally are up for it. So faster rehousing, better cost price points, and smoother processes, and then whatever we can do. We're not, the Red Cross is not going to solve poverty, and the Red Cross is not going to solve chronic healthcare problems. But we are seeing those who are most vulnerable. And when you have 100 people show up from a nursing home, each of whom now requires 5 caregivers. So that's 500 caregivers that I would need to adequately take care of all these people in this acute scenario.
Right.
Their health conditions are going to plummet. And at the end of the day, I have 3 nurses that I can put in that shelter. Go. Right. So that anything that can help us work through those problems, and I could talk for hours
Right.
about this, but I'll stop
No,
there.
but
Thank you
these
for
are
that
good.
question.
These are streamlined processes to think about, and hopefully in the hackathon, we can also address. This is really helpful. Thank you, Luke.
Absolutely.
Thanks for the question, Kari. And thank you, Luke, for really a great answer, which asks more questions than answers. But I think, yeah, thanks for the plug. The hackathon is looking at that. And yeah, shifting gears a little bit, but I think it sort of speaks to some of the questions you raised in your last slides. Bill's got a question about a different type of former resident displaced during the case of a fire.
Yeah, Bill, I lived that question for almost 4 months. You probably saw pictures of parking lot outside of a Walmart with a bunch of tents. It was cold, it was wet, it was rainy, it was muddy. There are, I believe, 25% now of people experiencing homelessness, and we don't say someone who's homeless, we say people who are experiencing homelessness. That's an important plug as we think about what that means, because you'll work in a lot of communities where there's a stigma against someone who is experiencing homelessness. But I think in Butte County now, 25% of people who are experiencing homelessness, somebody could probably Google and tell me my number's wrong, lost their homes in the campfire, but they still want to stay in the county. And you're watching a community, you're seeing a lot of those people get pushed around and just jolted around, which just makes recovery near impossible. And as the fire was actually happening, there was a large population, because I think the vacancy rate for rentals was like 1% in Butte County before the fire, maybe 3%. So there's already a large population of people experiencing homelessness. And so all of those tents you saw in, say, Chico, Butte County, Paradise, it was kind of like a 50-50. So you never knew who you were going to talk to and what their situation was. And for the Red Cross, I mean, we are, as I said, we're open, everyone's welcome. People are welcome to come into the shelter. We'll support an outside population, as we call it. So you can pitch your tent next to the fair, in the fairgrounds or next to the shelter. We'll have showers. They can come in for food, charge a phone, have access to those health or mental health services. We have casework teams that provide financial assistance. So an actual dollar amount on a debit card or direct funds transfer to your bank account if you've got one. And so, we do that, but it really takes, we call them the continuum of cares. Actually, we don't call it that, society does. But continuums of care, the COCs, those are large task forces that exist 24/7, 365 that are designed to help people who are experiencing homelessness. The state of California has found a lot of success in what originally with COVID was called Project Room Key, and now is Project Home Key, I believe, where people who are experiencing homelessness, let's get them off the streets and get them into essentially converted motels that were shut down or were released by the state with a big infusion of state and federal dollars. So you got people out of the streets, but think of the extended stay motels. That's a perfect apartment for someone. You got a small kitchenette, you can cook, you got a fridge, microwave, oven, whatever it is. And then there was that transition to, let's just not make this temporary. Let's just house people. And so the Red Cross is looking at this acute to chronic problem where we used to have one fire and now we have lots and lots of fires. And it was 100 people, now it's 10,000 people. So really trying to find ways to partner with organizations more effectively, because there's only three things we can do. We can put volunteers at a problem, we can put dollars towards a problem, or we can put the Red Cross brand and reputation, our convening power, to help tackle a problem. So we're not going to solve it on our own. We're really a support agency there, but we see those who are in the worst periods of their lives for a very short period of time. And so the question is, how can we at least hold them where they are, or help elevate them, 1 or 2 or 3 steps? And it takes a whole village to make that happen.
Bill, does that get to your question? He gave you an answer even before you even got to read what you want to say. Are you happy with that answer, Bill, or do you have any other thing to follow up with?
I don't want to take a lot of time, but I mean, a lot of the people in those tents are kind of my relatives, and I know they're low income. I mean, not, they're carpenters and drywallers and stuff, and they have local jobs, and there's no place to live because Chico State's right there. It's already a very high density rental area. and they're not really being offered any solutions. So I don't know. I mean, setting up long-term, I don't know what to do, but that's the reason I'm asking.
Yeah.
And it's a good answer, but there's a lot of people hurting.
Yeah, there are. I mean, I think, Bill, where the Red Cross can help is we can, I think with the brand that we have, the Red Cross is not going to get into the rehousing business, but where we can help is we could say, hey, for the hackathon that, for example, that focuses maybe traditionally on some of the technical things. What if we looked at an infrastructure hackathon? I was talking with the NASA Wildfires and Disasters team, looking at just big crazy ideas, because that's how they think. What if you had the National Mall every year looks at the future of housing? To me, you're looking at rezoning. You're looking at available land. So FEMA, after the Camp Fire, actually bought land and said, here's where we're going to put this trailer park. And there was a big article about the last person in the trailer park. So can land be converted? Can we find more and new innovative ways to build more rapidly, more affordable homes? But they may not look the way that old homes used to be. There's a lot of new materials coming on the market, and maybe to me that's a big idea where multiple agencies can and governments need to collaborate. But I think it's gonna take a change in society for people to be comfortable with that, to really understand. Otherwise, it's just going to be those people in the tents. And I mean, you look at sort of talk to people who don't live in California, you hear over and over and over again. Just anybody, it's sort of there's just all these homeless people in California, and everywhere you go, there's all these tents, and it's heartbreaking to hear that. And so the answer to unhoused populations is house people. But if we don't have the houses or the dwellings, we got to create them somehow.
Thank you. Sorry it takes so much time.
No, it's
a great question. I'm sorry.
Bill, and very heartfelt.
I'm sorry that hurt.
Yeah, that's really just a very relevant question. If you didn't catch it, basically, you can look at the chat, Bill, about Bill's question about 10 cities in paradise. Other questions for Luke? We have about 5 minutes left here.
I have a question. Again, thanks, Luke, for the talk and all the work that you do. You gave like a full overview about what all Red Cross is doing, which is great. I thought Red Cross is only on the response side, but clearly not. So, but can you give like maybe just like how much of the work that Red Cross does is in the response side and how much is in the prevention side?
Great question, Krishna. There's not a number, there's no like dollar number of where we spend, but I say response, no matter where you look, response is always more expensive. But that's probably the place where we should put the least amount of dollars. But at the end of the day, when a bad thing happens, you have to respond. And so everybody says, who cares? Let the dollars flow. But we have dedicated team members focused on preparedness, response, and recovery. The Red Cross preparedness space, we're trying to get more creative and more innovative. If any of you have ideas, we're all ears. Traditionally, we do things, we have sort of community preparedness. We'll talk to you about a go bag and how to evacuate, and just sort of here's your checklist of items. You may have seen that floating around, and a lot of the material that exists out on the internet comes from Red Cross, and we have a whole panel of experts that create that. We have youth education programs, teaching kids to cope with stress and how to prepare, because it turns out if you educate a kid, they can educate their parents, which is pretty cool. But we're also getting into very slowly with some pilots this year, looking at wildfire home assessments. So partnering with CAL FIRE in California, other state fire and local fire agencies to help be a force multiplier. We can bring volunteers to a problem. And so they have to, for example, in County X, they have to go inspect 1,000 homes. Could the Red Cross do some of those inspections? We're not going to go bring the chainsaws, but maybe there's another organization that can do that. So we focus on that piece as well, and then try to educate governments and just how to work together in a complex wildfire. That's a really important piece of preparedness too. So don't have a dollar amount for you, but we're trying to lean as heavy as we can into the preparedness and the mitigation side.
Great. Any other questions? I can stack one at the end, but I really want to open. I can talk to Luke anytime. So, any questions? Okay, I will wrap up with one then. You know, you just answered Krishna's comment about preparedness, and it seems like that really, right? Let's invest in being prepared. Where do we need, I mean, you said one of the questions is what's effective? Does the Red Cross have any idea on what has been effective and reaching not just the haves, the people that have a smartphone with Twitter that are on social media all the time? Has there been any research or preliminary answers onto that question of what's the effective way to not just tell people fire is coming, but to prepare them and to really get people to invest in preparing themselves, say, right now before fire season begins, whether you are living in a single family dwelling and upper middle class, or have a language barrier, or you know, the whole spectrum, right, of the population. Do you have any idea of what needs to be done to make people more prepared?
That's probably the PhD I haven't yet done. Looking at that one. And I know we're talking to some of the human factors behavior teams at Stanford, trying to have them help us and ask the right questions. But some things that we know that people trust is the most important thing. So like look at the pandemic and trying to get people to wear a mask or do this or social distance or whatever. People are gonna lean towards someone they trust rather than an expert. So how can you empower at the very local level people that people trust? How can you ensure that you're hitting every different platform that somebody might search with easy to access, highly personalizable or customizable information? Because there's a huge information overload that happens when it comes to preparedness. And then I think, you know, taking a page out of the playbook of who do people trust in the pandemic. You looked at the outreach into Spanish-speaking communities with the promotores during the sort of the Spanish-speaking version of the community health work. People were trained up and paid to go out and build trust. I was on a talk last week with some professors out of Maryland who were using barbershops as a way to sort of create health centers. So thinking about how we reach people where they are, and you have to do it before the disaster happens. And people, like, no one's going to show up to a disaster preparedness fair, because that's not, I mean, maybe it's exciting, but for a homeowner, that's scary, right? That's overwhelming. So how do we embed that into things that people do every day? So another idea that we're exploring, I'll close on this, I guess, is we're trying to really think outside the classic disaster box. So for example, we know that there's a huge technological divide between English speakers and non-English speakers. A lot of material is just pushed in English, and you're lucky if you can get it in Spanish. But we know that the kinds of problems that somebody who might be who may have just immigrated to the country or may not have assimilated in a way where they're getting fluent in English or they're older, they have all kinds of problems every day trying to navigate the technical world of paying this bill, doing this insurance, getting registered with this. So what if we had a technology fair where you just had, you know, an open space where you can help people solve problems and fix the iPhone or do this on a browser, and you've got a Red Cross or somebody, you know, the first responder who can maybe just inject a little bit of a message of, hey, when you came in, we also signed you up for these emergency alerts, and you should pay attention to this. And if this happens, then don't wait, you know, get out. Or can you nudge people? Can you gamify? Can you nudge people to get renter's insurance? Very low rates of renter's insurance where you think it'd be a lot higher. But at the end of the day, $8 a month to get $30,000 of coverage if you lose all your stuff, it's pretty good. So we're trying to think outside the box in that realm to reach people in more areas.
Fantastic. I'm sure people may have other questions. I hope you caught in the chat, Luke gave his email and phone number. You want to reach him. If you don't have time to look at chat, you have hopefully my information, dfong@stanford.edu, so I can put you in contact with Luke. Luke, thanks again for a great talk. Thanks again to our audience for a very lively discussion. We're going to keep going next week. We have Professor Gabrielle Wong-Perotti, and she's going to sort of follow up really well on Luke's talk. She's going to be looking at some of her research into the frontline communities and what they're seeing in the recent fires. So I encourage you to come next week and hear about that. And again, I encourage you also to encourage people to participate in our hackathon next quarter or take the class. Thanks again, Luke. Thanks again for everyone for your attention. Have a great afternoon and week, and hope to see you again next week.
Thanks, everybody.